Yeah, thank you, Ariana, again for a fantastic introduction. And yeah, I just want to reiterate, this is an exciting time to be talking about this topic. As mentioned, is more data being generated around the world than in throughout in like year by year than in most of human history. And we're now, at 4.6 billion active internet users around the world. We're generating billions of search queries, social media posts, uploads, and other data online every day. So I'm really excited to start this first panel on leveraging online and social media data for COVID response. All of our panelists are really working on innovative methods around online data and the response to the pandemic. And as we wait for them to jump on, I'll just begin introductions for the panelists, and we'll have them promoted shortly. So first off, we have our Robert Marty, who is a research analyst at the Development Impact Evaluation Unit at the World Bank, where his work focuses on impact evaluations of transport corridors and road safety. In particular, his work focuses on leveraging innovative data sources for impact evaluations, such as satellite imagery, crowdsourced data, and private sector data sources. Prior to joining the World Bank, he worked at the Aid Data Center and for development policy. He holds an MS in computational operations research and a Master of Public Policy from the College of William and Mary. We have Professor Frauke Kruter, who is a professor of statistics and data science at the Ludwig Maximilians University of Munich, Germany, and a co-director of the data science centers at the University of Maryland and Mannheim, Germany. In addition to her academic work, Dr. Kruter is the founder of the International Program for Survey and Data Science and co-founder of the Coleridge Initiative, whose goal is to accelerate data-driven research and policy around human beings. Next, we'll have Ernest Mbaze. Ernest Mbaze has a dual career in academia and industry. He possesses over 10 years of teaching experience in computer science and machine learning. While at Makerere University, he co-founded the Makerere University Artificial Intelligence Research Lab, leading it to prominence in the field of practical implementation and deployment of artificial intelligence solutions. In industry, he worked at the Google AI Research Lab in Ghana and the UN Pulse Lab in Kampala, where he focused on practical applications of artificial intelligence to tackle development challenges in agriculture, utility estimation, and different focus areas of the SDGs. He's passionate about using artificial intelligence to improve society, particularly in developing parts of the world. He's currently a founding director of Sunbird AI. And last, we'll have Shankar Iyer. Shankar Iyer is a research scientist on Facebook's core data science team. As part of the Data for Good collaboration, he works on building privacy-preserving data sets that address questions of relevance to humanitarian, first responders, and epidemiologists. So I think we're still waiting on getting the panelists promoted. So, oh, actually, is that, nope, never mind. We have everyone here. Looks like we can get started. And thank you all for joining us. As a quick reminder, we'll be, each presentation should be kept at time around 12 minutes, but we'll be kind of jumping in with about a minute left to let you know if that you're nearing time, and then we'll move be through all four presentations, which will be followed by a Q&A. So I really do encourage all participants here to post your questions in the Q&A box at the bottom of your screen. We'll be able to, and you can upvote other questions that are posted there too. If you have a similar question, you'd like that to see that one answered, and then during the Q&A, myself and the panelists will be able to kind of pick from among those questions and answer what we can. So without any further ado, so Rob, you're up first, and you can go ahead and take it away.
Perfect. Thank you. Let me get the PowerPoint up. Okay, great. Good morning or good afternoon, depending on where everyone is. So my name's Rob Marty. I'm a research analyst with the World Bank, and this is working in collaboration with a number of other colleagues within DIME as well. Um, so the work is focusing on using Google search and Google Trends data to understand the pandemic. Um, and just to place this in context a little bit, so this is building off of emerging work that uses Google search interest data to kind of look at caseloads of disease. So the work, I mean, kind of building off of, people are going to search for like symptoms or whatever before going to the doctor, or kind of to try to self-treat as well. Um, so the initial work with this focused on Google flu trends data, where the work was initially very accurate. Later there were discrepancies, and then later work was sought to improve that prediction for flu. And then the work has then been extended to a number of other illnesses such as dengue, Ebola, Zika, and a number of others as well. Um, and there's been some emerging work with using Google search interest data to look at COVID-19. So just kind of give a quick flavor of the types of studies. So there's been a number of work using symptomatic specific search words to try to see which search terms are both correlating with cases, and see which search terms could also help predict future increases in caseloads as well. There's been work looking at the economic impact of COVID, looking at employment related search terms. So there's work finding that employment or search activity in employment related search terms correlates with unemployment insurance take up. And there's also been work focusing on mental health related search terms such as boredom, loneliness, and a few others. Um, so for our objectives, so a lot of the previous studies have either been country specific or focusing on a few specific countries. So we're going to really take this at the global scale, and we're going to look at data across all countries for a number of different search terms. We're going to mainly look at three things. So first, which search terms correlate with and can help predict COVID-19 cases. Second, looking at the impact of COVID-19 and lockdowns on mental health and socioeconomic indicators. And third, seeing if Google Trends can reveal insights about vaccine disinformation. So for our data, we're going to scrape Google search interest data for over 70 different keywords. We're going to use Google Translate API to get to translate the search terms into the most popularly used language within each country. And then on the right, you just see a flavor of the different search terms that we use. So first, looking at which search terms tend to correlate best. So each dot on this chart is the correlation within a different country. And the main finding is that COVID-specific search terms tend to correlate best with COVID-19 cases. So the top two like search terms that we see correlate well is both loss of smell and loss of taste. That generally across a number of countries, we see a fairly good or fairly strong correlation. And then here, just to kind of give a flavor of a few different countries that have the top correlation, is just showing in green, you see the trends in search interest and loss of smell, and in orange, you see the caseload. So you see the correlation is both, or these trends kind of line up fairly well over time, even in more kind of these recent surges as well. And to even highlight kind of this correlation with the past couple weeks, in Kenya has seen a rise in cases in the past couple of weeks that we see both in the administrative data and in the search interest, and just focusing specifically on New York City, that has both seen a rise that we see both in the administrative caseload and in search interest of loss of smell. So there could be some worry that, kind of people understand the symptoms more as the pandemic has gone through time, but we see that, people are still searching for these search terms as it gets. And then kind of as the last slide hinted with looking at New York City, the correlation is also strong at a subnational scale. So just focusing quickly on the United States, we see the correlation about 0.5, just taking data from April. And then even if we look in the summer, as the kind of burden of COVID has shifted throughout the United States, the correlation has still stayed strong. So even subnationally, search interest tends to track well with caseloads as well. Then the team has also done a number of or bit of work with Brazil, and here we're kind of showing a similar correlation. Here, instead of just focusing on loss of smell, we're using an index of a number of related keywords. But I mean, here what we find is that the correlation just since the start of the pandemic has grown over time. So uh, and the correlation has still kind of been fairly strong. So I mean, here just kind of three different points of time and strong correlation, but correlation again growing over time. And then so what one of the main uses, and this is kind of coming from the literature as well, of using Google Trends data is to see if we can use Google Trends data to predict future increases in caseloads. Um, so the main way that people have gone about doing this is um, taking the correlation between cases and search interest and taking the lead and lag of cases. So this is kind of what this figure is showing. So we're going to push the kind of trend in cases back and take the correlation and basically look at, what's the lag and number of days of since we're pushing cases back and what's the highest correlation. Um, so it, it, so on the right is just the distribution of the lag of caseloads where the correlation is strongest for both loss of smell and loss of taste. And we said the correlation is strongest about 10 days before for loss of smell, or 11 days before for loss of smell, and about 9 days for loss of taste. And even across like the distribution, it's mostly negative, which is suggesting that you're going to see an uptick in search interest before you're going to see an uptick in an increase in cases. So it's kind of lending this use to Google Trends data of being kind of this useful warning system to see, okay, we're seeing an increase of cases. Maybe that's an area that we want to look a little more into, that we might be seeing an increase in cases. And then just a few examples where I think you kind of see this a bit more clearly, both, Syria and the Philippines and the States, just looking at a couple of these, both large spikes in search interests that are followed later by a large spike or increase in COVID-19 cases. In the second use that, I mean, both related to predicting cases, but the second use is, when there is a large discrepancy between search interest and reported cases, I mean, that could, potentially lend insight that, there could be something weird going on with the administrative data. So you might want to kind of trust the search interest data a little more. And just a couple examples, I mean, Turkey has had some issues with publishing some incomplete coronavirus data that, I mean, I think they've since corrected. But you see, I mean, this weird jump in July, and then both this like significant increase in search interest significantly before you see this increase in reported caseloads. And then Tanzania is a bit of a unique case where they've just stopped reporting COVID-19 cases, but we still do see some search interest in some of these keywords, such as loss of smell, over time, which suggests that there are some, lingering cases in Tanzania as well, despite the data that Tanzania is reporting to the WHO. And now turning to kind of away from predicting illnesses and understanding the impact of COVID-19 and lockdowns. So here focusing on mental health keywords. So this red line is just showing when a lockdown was implemented. And on the x-axis, you're seeing the days before and after a lockdown was implemented. So, I mean, here kind of related to the one paper I mentioned at the beginning, I mean, here's looking at trends in search interest in boredom, where we see this kind of like large spike in people searching for boredom kind of immediately after lockdown. Sometimes it's kind of, there's a bit of a pre-trend, but I think, like the US or Botswana, it's like, this pretty dramatic increase after a lockdown. And then just so looking at a number of keywords and seeing, which search terms tend to kind of have this spike afterwards, we're going to pull all countries together and use an event study model. So we're going to have a dummy for each time period before and after lockdown, and we're going to include country fixed effects. So to kind of focus on the variation within countries. So again, this is just pooling 70 countries together, focusing on boredom, or the search term for boredom. And again, so all these coefficients are relative to the day before lockdown was implemented. So we see a big spike in search interest in boredom, a spike in interest in insomnia, a bit of an increase in anxiety, a bit of an increase in searches for loneliness, as well as an uptick in worry. And to some extent, we're seeing an increase in search interest in suicide as well. Doing a similar exercise for looking at employment. So this is looking at trends in search interest in employment. And again, we see kind of a big uptick in unemployment search interest post lockdowns. And again, doing a similar exercise with looking at kind of these event studies fixed effects model. Again, kind of pooling 98 countries together, we're also seeing, an uptick in unemployment search interest post lockdowns, also with unemployment benefits, filing for unemployment offices, and unemployment insurance as well. And then finally turning to looking at kind of like search interest revolving around COVID-19 vaccines. So first, there's kind of big global interest in understanding kind of COVID vaccine side effects. Kind of people searching for, kind of what's going to happen after I get this thing. But then, we can also use Google Trends information to look at some of the vaccine disinformation that's been going on as well, and seeing which countries where that's most prevalent. So here, just looking at this kind of theory that COVID vaccine, especially with these mRNA vaccines, are going to change your DNA, or that it's linked to infertility. So we can see kind of like trends in a few specific countries where that's happening. And even focusing specifically on the United States, we can see how, a few of these kind of misinformation ideas are kind of spreading throughout the United States, or which states people are particularly searching for. Google, some of like Twitter and like Facebook is, I think, removing some of these posts, but it doesn't stop people kind of from searching for other sources as well. So Google search interest may be kind of a particularly useful thing to kind of track some of this misinformation as well. And then, so finally, we've pulled a lot of this information together in a dashboard that's both going to show the top search terms across a number of categories. And this is the bit.ly link there if you want to check that out. So the dashboard does show how the correlation between search terms and cases varies across country, and gives a fairly easy way to see, which countries this works well and not as well in. And then we also give the ability to kind of, for a specific country, look at, which search terms work kind of best in that country. So in the States, loss of taste works a little bit better than loss of smell, but in other countries it could look, a little bit different. And we're also going to show kind of both the historic trends and also pull in recent trends as well, just to kind of help make this data a little bit more accessible. Great, so thank you very much.
Thank you so much, Rob, and really fascinating presentation. I really appreciate that. And we'll have some questions already coming in on the chat that we can answer in the Q&A. For now, we'll move on to our next presentation. Frauke Kruter, you're up, and thank you for sharing your screen. We can see it.
Perfect. Thanks, everybody. And this is such a perfect match to what we just heard. So I'm excited that these talks are back to back, because this project that I'm going to present today to you has sprung up with a similar desire to have data available very quickly, maybe before official reports are available, to track what's going on in the pandemic. Just briefly want to acknowledge this is a collaborative effort between the University of Maryland in College Park and Carnegie Mellon University, but also with contributions from several folks from Johns Hopkins University, in particular the Bloomberg School of Public Health. So as I said, it was clear pretty quickly in April, March that there is a need for some form of syndromic surveillance that helps to, maybe give early warnings in which areas the next outbreak might occur, where we have particularly worrisome or rapid speed of transmission. And so the question was, how can one, on a fine geographic level, but also worldwide, get this information on early symptoms. And several public health researchers approached Facebook to help with this endeavor. The fact that they are a global platform and have a lot of users on their platform was sort of their intent to take advantage of that and survey people through that platform. I'll show in a minute how that was done, but this sort of for the intent. The survey has evolved since then. It's far more than just symptoms, but that was the initial push for this project. So let me give you a brief overview of the project structure. And while I'm pretty excited for this as a data source, even so we all know that it doesn't cover the entire population, given that not everyone is on Facebook. So how is this happening? Facebook invites a random sample of all the active users to participate in the survey each day. This means there's an invitation popping up on the top of their newsfeed. So it's not an advertisement survey, but they pop up at the top of their newsfeed as an invitation to take the survey. And because Facebook doesn't want to collect the microdata, they want to make these data publicly available, which wouldn't be possible if they would collect it. They partnered for the US with Carnegie Mellon University and for the international portion with us in Maryland, so that we host the web survey that takes in the answers to these particular questions. What we do get, though, from Facebook is weights, and I'll say a few more things about that. But it basically allows us to take advantage of knowing the sampling probabilities from the albeit unusual sampling frame. The data is then used and provided in the aggregate continuously via an API and in the microdata form through data use agreements so that researchers around the world can use them. The survey instrument itself on the global survey is translated into over 50 languages and has 5 sections. There's a pretty long consent statement, in particular for those countries that are covered by GDPR. There is a segment on health symptoms, including loss of smell and similar things we heard in the previous talk, but also a whole set of questions on behaviors, so social distancing behaviors and adherence to the various early interventions or recommendations. So that was pretty interesting to watch, from hand washing to not longer meeting people and what have you, and how that changed over time. And so probably capturing some of the things that one might not see in the search terms. There's also a section on mental health. This is in particular spearheaded by the team at Hopkins. On economic security, and most recently, the latest waves of the survey included questions on vaccinations. There's a small demographic characteristics portion at the end. It's a little larger in the US, only because the population is more clearly defined, and it's easier to ask for example, race and ethnicity, which in the global survey would be very hard to do, because then the instrument would need to be very different for each of the countries at the same time. So keep in mind that people go to that survey, then they pick the country they're in currently and the language they want to take the survey, and then everything sort of happens from there. But the web platform has its limits, and so it would have not been possible for us to have, for every country its own survey. So the whole point was to have a comparable instrument across all these countries globally. By now, about 40 million people have answered the survey on the globally, plus the 17 million that completed it in the US. The sampling strategy is a little bit different in the US than it is globally. Globally, we sample and provide estimates for region 1 levels, so the equivalent of states in the United States or Bundesländer here in Germany. But in the US, the data are available on a county level. This too is changing. We're trying to get some equivalent of a postal code added to the global survey as well, so that even more fine-grained estimates are possible. I mentioned earlier, and some of you who know me, I'm a survey methodologist, right? So I'm very particular about biases and worried about not covering the entire population. So why do I like these data nevertheless? Well, for one, the population, albeit not covering everybody, we do have a clearly defined population, which is the one of Facebook users, and we do have clearly defined sampling weights, and we are able to get from Facebook non-response weights. So they internally, we hear later from the data science team, so thank you guys for providing those weights. They use data available on the Facebook platform to basically predict the probability of someone participating in the survey and convert that into a non-response weight that sort of helps us to have the estimates or account for the people that were invited but did not participate. In order then to map the responding population to the population in the entire country, we use the demographic questions that we have for well, the demographic information that Facebook has, I should say, for the post-stratification. Now, there could be further weighting done with the actual response data from those using the microdata, but that's not the kind of weights we provide here as part of the survey. So, you know, I think we could talk forever on sort of the, you know, who's not there and whatnot, but keep in mind, this is designed as a surveillance system over time, right? So we were interested in trends and we're interested in early warnings. And with the small assumption that we think that the being on the platform is unrelated to catching COVID, this is a pretty good longitudinal measurement device, I should say. So early insights, a lot of organizations jumped on this pretty quickly. We have right now over 60 institutions that are working on the microdata via the data use agreements. The IHME has been doing a lot of work, in particular early on mask use across the world. Here's sort of a snippet of their maps. If you go to their website, you will also see that they are feeding from the API we create into their worldwide mapping of what is going on. The Social Data Science Center at the University of Maryland has several blog posts with early results in case you're interested. Picking different themes, mask wearing was one of them. I mentioned financial anxiety is a question. Remember, these are daily cross-sectional samples of the population. So this is not longitudinally asking everybody again and again. It's, you know, a random sample anew every day in each country. And here sort of trackings from July till the end of the year on financial anxiety, just to give you a sense. Again, here, similar to what you saw in the earlier presentation, mapping the responses from the survey to the reported data. Drill down by geographic region, region 1 here for Indonesia, possible. As I said, that indicator is available in the data. Here you see the questions about financial about the finances in the household for the next month depicted for Indonesia. We tried to early on synchronize as best as we could with the World Bank the way we formulated the questions. And so hopefully there's some crosswalks of the data possible. Of interest, the dashboard that was built by our Geospatial Center in Maryland. Here you have the way if you want to play around with the microdata and don't have the capability or the possibility to do that directly via the API, you can use the dashboard and select variables that are on the survey, select countries, either countries to be compared or countries, and then within countries, several regions, and compare those and the developments over time. So there, this map has quite a few features, and it's worth revisiting because, you know, I feel like every week they're adding something to it. I mentioned the data access a couple of times. So here are two links that could be of interest to this community. The COVID map .umd.edu, that's where you find the API. And then likewise for the US, the CMU Delphi group. If you're interested in the non-aggregated data, the entry point is the Data for Good at Facebook. They're getting you onboarded, if you will, and equip you with the data use agreements. With this, I can close out, and we will be hearing more about the various data sources from Facebook. So no need for me to get into detail. And I think it will be very fascinating to see how these various sources can be combined. And I'm, dying to know how this compares and if we pick up complementary signals through the various sources. Thank you very much.
Thank you so much, Frauke. And that is, you're right, that is a real, real perfect tie-in after Robert's presentation. Two of the largest online platforms and really innovative ways in which we're finding to measure COVID trends with them. So as a quick note to the audience, we've enabled chat, and if you would like to introduce yourselves in the chat, folks are doing that now, so feel free to type in your name and affiliation and what country or place in the world you might be coming from in the chat. And I'll turn on my video here. And yeah, without any further ado, we'll move on to Ernest Mbaze. Go ahead and we can see your screen, and thanks so much.
Great. Thanks a lot. Thanks a lot for having me. So I'm called Ernest Mwebaze from Sunbird AI, and I'll talk a little bit about social media data and perceptions from COVID messaging. So, hold on. All right, there you go. So a little bit about Sunbird. So Sunbird is a not-for-profit organization in Uganda, newly created, and our mission, our goal is leadership in AI, particularly in this context of Africa. And that means two things for us. One is using AI to generate evidence for policy through different types of engagements, particularly with the public sector. And in line with that, contributing to policy in AI, particularly for this context. And so the work I'll present here is really about social media monitoring. And this work was done in Uganda. So at the onset of COVID-19 pandemic in Uganda, around March 2020, when it got serious, several committees were set up to address the situation. And we mainly worked with two, one at the Uganda Ministry of Health, COVID-19 task force, that particularly communicates about COVID, the official COVID task force. And then another task force at Kampala City Authority, which is the body in charge of Kampala, the capital city of Uganda. And these statements you see here were obtained after about a year's engagement, so with the different teams. And I think I highlight them here for two key reasons. One is the statement on the left from Agnes, who's from KCCA, the Kampala City Authority, that they were able to provide insights from COVID that otherwise would have been difficult to derive and understand from social media data. And then the one on the right from Caroline, I think the key thing there is that this work informed their communication strategic decisions. And I think these two ideas resonate a lot with the mission of Sunbird AI, but I think they're also core in any sort of AI for social good engagement, that you can infer some knowledge from complicated data and that this knowledge can be used to make decisions. All right, so what did we do exactly? So our goal, we really set out to understand perceptions and reactions of the public. The public here, the public is mainly the Ugandan public, or you could circumscribe it to the public that is on social media here. and wanted to understand the perceptions to COVID-19 messaging from the Ministry of Health and the city authority. And we did this in two ways. So one was looking at the Ministry of Health, the official Ministry of Health, and KCCA Twitter handles and Facebook IDs, and analyzing reactions to official messages. So the things people comment to these postings. This could include comments, retweets, likes, or even just looking at the different emoticons. So that was one aspect. The second aspect was trying to identify all the COVID-related tweets or posts from Kampala and Uganda generally, and analyzing these to try and understand the perceptions of the public. And basically the result of this was packaging this for the ministry and the city authority. So one other avenue of monitoring was radio, and here the goal was less ambitious, more of an audit task to count the number of COVID-19 related adverts that the ministry was sending out on radio in different languages. So this is sort of one of those tasks that falls in the category of intractable to do manually. So someone to sit down all radio stations and listen to them, but which tends to be fairly easier to automate. But for this presentation, I'll dwell more on the social media monitoring. So what was our plan? So small spoiler alert. So this presentation is not mainly about brilliant results we got from analysis of social media data. It's about really the experience of trying to computationally address a real challenge under these dynamic constraints, which is sort of prototypical of real world problems. So our theoretical approach to the problem generally involved this plan, which is sort of a standard plan for developing an AI system, collect a large quantity of COVID-related social media data, perhaps using some location and topic filters, try and annotate this data in such a way that you can build good machine learning models. And then from that data, build a deep neural network language model for Uganda COVID social media data. And then use this model to sort of do all these inferring perceptions and identifying messages and etc. This was our grand sort of theoretical plan. So in practice, this doesn't necessarily work like that. So what did we actually do in practice? So one key thing was that there was a rapid evolution of the pandemic. So the rapid evolution of the pandemic meant that the ministry required rapid analysis. And so I think the first analysis I'll talk about was something they told us to do in 3 days. You guys are doing social, okay, give us something in 3 days. And so this is not enough time to build models. So we did a lot of the work manually. The second was collecting this social media data, which is not straightforward. So I think the presentations you don't see in this type of workshop are those people who really tried and failed to get data. That was otherwise the ideas they had were really good. And so even collecting data, getting the required permissions to collect social media data is a bit complicated. So initially we could only get a limited set of Twitter data, and we had no Facebook data initially. Then insufficient time to annotate and train a deep neural network. As I said, so some of the analysis were like, give us analysis, we have a meeting in 3 days, and you really don't have time to really train the data. On top of the data not being sufficiently available. And so we did some manual things here and did some bit of data analysis with notebooks and things. And then, normally the last part is, creating a fancy V's to present results. Again, we couldn't do this very easily. All right, so what did we do? So I'll give an example of the first analysis we did. So once all the relationship building had been done with the ministry, which is another complicated task, our contact came back to us and informed us they have a meeting in 3 days and they required some analysis of public perceptions. So what did we do? We said, okay, we need to do this manually. We went and collected tweets for 2 weeks, about 1,000 tweets we thought were related to masks. So masks was a big thing around this time. And then we manually examined them to identify categories. And then from these categories, we derived some sort of major themes of what the public was saying. And some quick analysis of this sort of looks like this. We found, for example, one of the themes were a lot of concerns about time, cost, mask distribution. You can see some of the tweets, you know, a policeman stopped me. I was alone in the car. He demanded I wear a mask. I challenged. So there was a lot of concerns around how this strategy of government distributing masks was implemented. And then there were several queries about how masks are used. Again, we sort of identified the proportion of tweets of these 1,300 that were people sort of asking about this. And then the last category, which was sort of the smallest, was political concerns. So there was a lot of politicization of the government exercise to distribute masks. And one of the things that sort of came out was once we plotted, for example, these tweets about masks, then for the ministry, we see clearly when they provided official guidelines, ironed out all these things, then you saw that the discussion on masks sort of dwindled. So going forward, we started providing sort of bi-monthly updates to the ministry, again in form of a slide of decks, a slide deck of analytics. And we focus mainly on looking at interactions with official posts from the ministry and KCCA to maintain privacy of the data. And the focus was on public Twitter handles and Facebook IDs. For Facebook, we leveraged CrowdTangle. So CrowdTangle is a product from Facebook that does public, that sort of gets insights from public content. And it's very good. So this diagram you see on the right is one of the things you get out from CrowdTangle. So from this, you can see almost daily interactions, you know, 12,000 daily interactions with these posts that are sent out. And so you can sort of see likes, comments, what people are angry about. And these were useful for the ministry. We had some examples and we plotted this over time. You can see which peaks, for example, these are likes. What did the public like the most of all the posts that were posted, and what were the comments around that? And then things like angry, what were people most angry about? There are things around fake news. You know, you could identify where the fake news was. Well, we didn't identify where the fake news was, but some of that content had the most reactions. And so the ministry had to come out and sort of declare some of them fake. And then sort of for the AI part, we sort of eventually over time, the ministry and KCCA wanted sort of longer term analysis, looking at longer timelines. And at this point, there was more data also available to build some machine learning models. So the main goal here was to model, of our modeling was sort of to identify COVID tweets from a mass of social media data. And we did this by leveraging sort of the open source resources that had started coming out, some data, some pre-trained models. We collected and annotated some data that's specific for Ugandan tweets. And we leverage some of these resources like the Hugging Face Twitter and COVID model to build a model. And so we came up with this thing called the SandBAT model, which is really a fine-tuned BAT transformer model on COVID-19. And we tested this on 1.9 million tweets that we had. And this one this came about 3 or 4 weeks ago. The ministry was like, okay, we're seeing a trend. Give us an analysis over time for a whole year. We want to understand why the cases have gone down, why the hospitals are getting empty. We don't understand why the cases are going down, and want to see if social media has this kind of analysis. And the things we're able to show were things like there's a huge decline in the number of tweets. So we use a model to get 1.9 million tweets over the year and try and score those which are COVID. And you see a huge trend. The graph on the left shows a trend in tweets. The graph on the right shows the trend in tweets as a proportion of the overall tweets that are tweeted. And there's a clear trend in decline. And these are some of the things. So this was results from our model. You can see it gets some things wrong where you have test and virus included there. And so maybe lastly, what were the key lessons? I think the key lessons we learned were this idea of a dynamic time-dependent problem. So the client was the ministry, the city authority kept redefining the problem. We are seeing this trend give us some analysis from social media. So you can't keep rebuilding a model. So this idea of doing this came out. Then the other thing was sort of the reality of working with a real problem, a pandemic. In some of the meetings we had where we were giving feedback, I think for one particular meeting, one of the people was supposed to be had died of COVID. I mean, the meeting stopped. You couldn't continue giving these analytics at that point. And so the reality of working with this kind of thing came to face. And then the last one was the need for AI resources. I think that's it. Thanks a lot.
Thank you so much, Ernest. That's such an interesting project. I really appreciate that presentation. All right, and a reminder, continue asking questions in the Q&A and introducing yourself in the chat. And if any of the panelists want to answer questions via tech or via the Q&A, you can do that as well. I might pick some of the questions you've answered if they're particularly interesting for you to read out anyways. But all right, moving on to Shankar Iyer. You can go ahead and share your presentation.
Yeah, sorry, it took me a second to get situated. Hi, I'm Shankar. I'm part of the Data for Good collaboration at Facebook. In Data for Good, we try to build privacy-preserving data sets that can be useful to humanitarian organizations and epidemiologists. Today, I'm going to be telling you about one of our epidemiology-oriented data sets called collocation maps. Before I begin, I just want to point out that collocation maps are built by a large collaboration at Facebook, including my colleagues listed here.
Shankar, I think
yeah.
I think we're only seeing the agenda right now.
Oh, okay. Sorry about that.
No worries.
Let me see. How about
now? Now I can see it. Yep.
Okay. Yeah,
all
sorry.
Good.
Great. Right. So collocation maps grew out of earlier work that our team did in the natural disaster context called Facebook Disaster Maps. So disaster maps aim to address crucial questions that humanitarian organizations face in the days and weeks following a natural disaster. And they measure where there have been important crisis-driven changes in population patterns, in movement, cellular connectivity, and so on. They've been shared with humanitarian organizations such as the Red Cross and World Food Program for the past 4 years. And they've been used to decide where to distribute relief supplies, where to set up Wi-Fi hotspots, to reestablish connectivity, to estimate how many people can be reached from various forms of emergency messaging and so on. If you're interested in this work, I can point you to this paper that some of us wrote at the ISCRAM conference a couple of years ago. But for the present purposes, I'll just point out that disaster maps are built from mobility data of people who have consented to share such data with Facebook, and data about how people are moving through geographical space, as many of you will know, is, while it's useful for the natural disaster context, it's also very important for epidemiological modeling. So when we started releasing disaster maps, we also got interest from epidemiological research groups who wanted to use the movement data in particular to parameterize their models of disease spread. And some of them went and did that, but we also started talking to them about opportunities to build data sets specifically for the epidemiological use case. And collocation maps are sort of a product of those discussions. So the basic question that collocation maps attempt to answer is, for a pair of geographic regions X and Y, what's the probability that a randomly chosen person from X and a randomly chosen person from Y are simultaneously located in the same small region of geographic space? So as a concrete example, let's just take a fictional example from Italy. Consider one person represented by the green circle who lives in Venice and another person represented by the yellow circle who lives near Naples. The person represented by the green circle spends most of their time near Venice, but maybe partway through the week, they fly down to Rome and they spend a couple of days there before coming back. And the person represented by the yellow circle spends most of their time in the Naples region, but then maybe partway through the week, they take a train up to Rome and they spend the rest of the week there. And when these two people happen to be in Rome, they maybe by chance, they end up at the same cafe at the same time. That's an opportunity for them to transmit a disease between each other. And the goal of collocation maps is to calculate the rate at which these types of potential disease transmitting events happen for any pair of regions in aggregate. And so in collocation maps, we compute this sort of weighted network between any pair of regions at a regular temporal cadence, in particular weekly, for regions all over the world, and share it in a privacy preserving way with epidemiologists. And the goal of this talk will be to argue that this is useful for understanding and modeling disease spread. So let me just start by talking a little bit about the underlying data, how we prepare that data, and how we share that data. So when I say mobility data, what I'm talking about are location updates about individuals that look like this. There's a timestamp and anonymized UID representing the person and something called a Bing tile. A Bing tile just refers to a particular patch of Earth's surface, and it's constructed by repeatedly dividing a rectangular projection of Earth's surface in fourths. So at level 1, there are 4 big Bing tiles. Level 2, there are 16, level 3, there are 64, and so on. We often work with level 16 Bing tiles, which correspond to 600 meter by 600 meter patches near the equator. And 600 meter by 600 meter patches are typically smaller than administrative units like cities or counties. So Bing tiles can also be grouped into these larger geographic units when we need to do that. And our mobility data consists of these types of location updates for those people who have opted into sharing this information with Facebook. And in collocation maps, what we try to do is construct complete week-long trajectories for individuals. So as an example here, consider someone named Alice from Santa Clara County here in California. So a complete week-long trajectory would mean that we have an estimate of Alice's location in each 5-minute bin during the week. In practice, we don't have that, and we need to do some imputation. I don't have time to get into all that here. For the moment, just let's assume that we have estimates of Alice's location in each 5-minute bin, which means that we have an estimate of the level 16 Bing tile she was in each 5-minute bin of the week. We can compare that to someone else's trajectory, let's say Bob from Alameda County, which is a nearby county here. And we can compare these trajectories. And if we compare them, we see that Bob and Alice were in the same level 16 Bing tile in 5 of the 12 5-minute bins from this hour that I've illustrated here. So those count as 5 collocation events, 5 times that they were nearby each other in geographic space. And by doing this for all pairs of people from Alameda and Santa Clara County, we build this quantity PRS. So in PRS, the numerator on the right-hand side is the number of collocation events between all pairs of people from the 2 counties, R and S, here standing for Alameda and Santa Clara. And then the denominator, NR and NS, are the populations of Alameda and Santa Clara counties in our data. 2016 is the number of 5-minute bins in a week. So the denominator can be interpreted as the number of possible collocation events in a week. And this ratio gives you the probability of collocation in a randomly chosen 5-minute bin for a randomly chosen pair. So it's this quantity PRS that we share in collocation maps with epidemiological partners. One thing I want to point out before moving on is that there are 2 relevant spatial scales here. The first is the spatial scale of RNS, which are counties in the US and county level equivalents elsewhere. And the second relevant spatial scale is the collocation scale. So how close people have to be in order to be counted as collocated. And that's a smaller geographic scale, here level 16 Bing tiles. Ideally, we would want that scale to be so small that the people were standing face to face, or close enough that one could cough on the other, for example. We don't have that type of information. So instead we have to work at this coarser scale of level 16 Bing tiles in the hope that that level of collocation is sufficiently correlated with face-to-face collocation that it can still be useful for epidemiological modeling. And I'll share some evidence later that it is. So the shared matrix looks like this. It has, each row corresponds to a polygon-polygon pair. So it has the names of the polygons, the population count for each polygon in our data, and the link value, which is PRS. Partners can inspect this data in a secured portal called GeoInsights. They can visualize it, or they can download the data and use it to feed into their models. I just say a few words about privacy and data security in co-location maps, and really in our maps in general. These are only released to vetted partners who have signed a data license agreement through this secured portal called GeoInsights. The released matrix only contains rows where both polygons have at least 10 people represented in our data, and where both polygons are in the same country. This is to avoid releasing potentially sensitive information about cross-border movement. And the way that co-location maps are constructed sort of average over daily rhythms in people's mobility by looking at this week-long window and by aggregating over many people. And it's the sort of daily rhythm in people's mobility that are highly unique over individuals and are therefore sensitive from a privacy standpoint. So we sort of wash those away through this averaging procedure. A couple of empirical properties of co-location, which indicate why it might be useful for epidemiological modeling. The first is just kind of a sanity check that the rates that we calculate in co-location maps actually captured the major mobility changes of the past year. So these maps compare the median co-location rate within each country to a baseline from March of 2020. And what we see is that there was a sharp reduction in co-location in the first months of the COVID-19 pandemic in almost every country. But then as the situation improved in many countries in the summer and mobility restrictions were dropped, we see co-location growing again in a lot of parts of the world before dipping again in the fall when things got worse and mobility restrictions were reintroduced. Another empirical property that I want to point out is that co-location is a measurement on a link between two geographic regions, and it's not the same thing as measuring direct movement between those two regions. So in this figure, what I'm plotting here along the y-axis are I'm stratifying these links by the level of direct movement between the pairs of regions. So the lowest strata are pairs of regions where we only see less than 10 people moving on a typical day between those regions. And the top strata, there are thousands of people moving between the two regions. And the x-axis is a distribution of the number of co-location events between the two regions. What we see is that if there's a lot of movement between two regions, then there's also a lot of co-location, but the converse is not true. There can be pairs of regions there where very few people move between directly, but where there's still substantial amounts of co-location. And this could be, for example, due to commuting, right? So the amount of co-location between Alameda and Santa Clara counties, which are two counties here in the Bay Area, is greater than you would expect by the direct movement between them because people in the two counties meet up, for example, in San Francisco. And those contacts are epidemiologically relevant because that could still contribute to disease transmission between Alameda and Santa Clara counties. So during the COVID-19 pandemic, people have actually used co-location maps data to build epidemiological models. And I just want to share some examples of that. So this was early work applying co-location maps to modeling in Taiwan. These authors found using co-location data that mobility restrictions within cities had a greater impact on the risk of an outbreak reaching a given size than mobility restrictions between different cities. But they also found that mobility restrictions between different cities can help narrow the geographic scope of an outbreak and help target resources. Another group in Texas found that when mobility restrictions were introduced in the US, they tended to have the greatest effect on between county co-location and much less on within county co-location. And they also found that when co-location drops, there tends to be a drop in case counts with a week of delay. Finally, a group in Germany, in Munich, they took many of the covariates provided by Data for Good, including many of the ones that were mentioned by Frauke in her talk, and put them into models of the evolution of case counts in German states. And they found that co-location was the strongest predictor of temporal changes in case counts. So I wish I had time to go into more details, but if you're interested in more details about the methodology, various challenges we face in trying to improve these maps, and opportunities for improving these maps, please consult this preprint that we put out a couple of months ago on the medRxiv. Just to conclude for now, collocation maps empirically measure these mixing rates between different geographic regions. They're available to epidemiologists through a data license agreement with Data for Good. They've already been used to parameterize models of COVID-19 spread and to measure the impact of mobility-oriented interventions. If you're interested in using these maps, or if you have ideas for their future development, please reach out at this email address. And thanks.
Thank you so much, Shankar. Really interesting application, and really, it seems like really useful public policy insights drawn from this project. So thank you. And we've gotten a lot of questions in the chat, so we can move to our Q&A round now. And thank you. I think some of the questions have been answered. I might ask a few first that haven't been answered, and might move to some of the ones that have been answered as well, just because there's some really interesting answers and really interesting questions. So one question for Robert and Ernest from Neha Degonkar. Neha asks, how do you address for data deserts, specifically or especially in geographic areas with sketchy internet or access or minimal tech access in rural areas? Any thoughts on that? Either one of you are welcome to answer.
Hi, Ernest here. I think I'll just go first. So I think we did think about this, and of course, social media tends to be restricted to a very small area, a small number of people, but we thought for a very dynamic, changing situation like a pandemic where there was limited information, I think getting a rapid understanding of sort of the perceptions of the public towards interventions was a good sort of thing to do. And so we focused on that part and didn't do coverage. So I think that's a gap in our research.
Yeah, I think that's a super good question as well. And that's one of the things our team has been thinking about now as well, is trying to, I mean, there's definitely a lot of variation in how strong this correlation is between COVID-19 cases and search interest for things like loss of smell. So one of the things that we're thinking about now is how the variation in that. And I imagine, like one of the big drivers of that is kind of like these data deserts or people not having access to internet, or kind of, issues around reporting as well. So it's something that we're, I think, definitely thinking about and looking to explore a little more. I don't have results yet, but it's definitely something that's been on.
Gotcha. Great. Yeah, it's good to hear what and yeah, go ahead.
Yeah, I just want to report one thing. I think that to some extent, we have seen in our data that while this might not help with the geographic deserts, but maybe with sort of individual people not having access, we did see a strong predictive power of anything reported on the community. So knowledge about cases in the community, for example. And so I would think that with the search terms, for example, that it's not necessarily always just about that individual who has the internet access. And so thinking of it as a sort of methodologist, there's the coverage is not a one-to-one mapping. And so it would be interesting to sort of take a look at this from both angles. My other suggestion would be, I mean, we've seen our data used and then the small area estimation techniques applied, in the combination of these data sources with others. Yeah.
Gotcha. That's really helpful. So we have another question here from Victor Roscoe. I think this might be for you, Ernest, but anyone is welcome to answer. So the question is, can the Twitter and Facebook analysis inform both the content and targeting of social media campaigns? For example, that certain language or influences are more likely to trigger social media users to share information with their networks. So and if not, what existing data is missing to inform COVID campaigns?
Yeah, so I think what we found, I mean, one of the insights we got, at least on the format of the content, was, for example, even simple things like having graphs or pictures or videos as opposed to having a text, was you had more reactions. So people liked that most, or they shared it most, or So that was one thing we saw. As regards the content, that's very hard to tell. Things are very dynamic with the public, so I can't really say that. But I know for sure formatting definitely had an effect.
Gotcha. Yeah, that makes intuitive sense, and from anyone who's used social media. Another question from Joachim van der Kastelen. So I think this is this might be for you, Frauke. The question is, when using unstructured data, are you concerned about and do you address spatial clustering or autocorrelation?
Yeah, it looks like this goes to both me and Robert. So the data we collect are all collected via through a web survey tool. So it comes out in a structured way. We avoid open-ended questions for privacy reasons. That would be too hard to do, and clean of any PII quickly. But we do, so the any spatial or individual correlation, we prevent basically upfront, and not the spatial, but the autocorrelation within individuals by having, I think it's a 4-week cooldown period before someone can get resampled into the survey. So we won't have same people over and over just because they're frequent Facebook users. But Robert, I think the unstructured part is probably more directed at you.
Yeah, great question about that. And I think definitely the spatial autocorrelation will matter for our data as well. Just thinking about countries with high COVID cases, probably neighboring countries are seeing similar trends. It's not something we're controlling for or dealing with now. We're just looking at within unit country correlations. But one thing I'd be interested in as well is trying to see if there's spatial autocorrelation and like the strength of the correlation across countries, or just even like search interest generally. I don't know if one country sees strong search interest, do like neighboring countries or even regions or states within a country see a strong and that could matter for explaining or trying to predict COVID as well, where you might be searching you might be searching kind of like COVID related symptoms a lot because your neighboring state is seeing an increase in cases while your state maybe not. So that could explain search interest as opposed to cases as well. So I think incorporating that spatial autocorrelation would be super important, especially as you get more local as well, when you're trying to kind of like predict whether the search interest is actually indicating increasing caseloads or not as well. So yeah, that's a super great point.
Great answers. Thanks so much. Another question from Artash Nath. This is for Robert. Enjoyed your presentation and the use of Google search data from different countries for prediction impacts and to check the spread of misinformation. Were you able to validate the findings from Google searches with other data from Google? For example, mobility trends data, and did more Google searches on COVID-19 symptoms lead to lesser mobility of their devices, i.e. greater following of social distancing norms? Any answer there?
Yeah, that's like a point as well. With the vaccine disinformation, we haven't validated that, but just so far we've kind of like scraped some recent searches in the past like couple of weeks just to see what these trends look like. But I think that's definitely something we want to kind of validate as well. Like the main validation that we do is just kind of like bring in the case level data to see how well things correlate. But I think it's a super interesting point with the mobility trends. And even with the impacts of like unemployment and things like that, do areas with larger surge into things like unemployment or kind of unemployment, or kind of like those characteristics, do they see like other measures of more limited like mobility, or these other indicators of like a lockdown being more severe? Because right now we're just using kind of like a measure for a lockdown started, but it would also be good to kind of bring in how intense was that lockdown, where people like really not moving, and then, kind of see if like mobility was really stunted, then, I mean, how does that impact search terms as well? Yeah, so something we haven't done as much, but I think that's, I mean, it's super good point and something we're definitely going to be, I think, doing a little bit more. Yeah, so thanks for the question on point there.
Yeah, thanks for that answer. That's a fantastic answer. A question for Shankar. What is the source of the location data? Are any data sources like cell phone towers better than others? For example, like IP addresses. This is from Harsh Anuj.
Yeah, so the mobility data that we have is sort of GPS style location traces. Sort of addressing the second part of the question, yeah, generally speaking, I would say that the cell phone tower data is preferable to IP data because people spoof their IP, and cell phone location data is a little bit more refined spatially. And the GPS style data that I'm referring to is more precise than that also. But I still think it generally has a resolution like limit of tens of meters. And so it's still not sufficiently precise to like see whether people are standing face to face, for example. But yeah, it's generally like GPS style data that we have for the recent past. It's for people who have consented to share this type of data with Facebook in exchange for location-based services. And we have the individual level data on our servers for 45 days, in which time we aggregated into these maps. So we have it for the recent past. And yeah, the sort of, hopefully that gives a flavor of what the data is like.
Right. Yeah. No. That definitely gives a better picture of where it's coming from. Robert, I was going to actually switch to one of the questions you answered in the chat, but I found interesting. It was Sadish D asked about whether there are any suggestions on making the symptoms and search trends data comparable across time and geography. He had a good answer and wanted to prompt you to answer it live too, in case anyone has missed the answered chat section.
Yeah, that's a really great question. And I think some of the literature about Google Trends wrestles with this as well. Because basically whenever you get Google Trends data, you get a value between 0 and 100, where the 100 is just kind of like the maximum value for whatever you scrape, and like 1 or 0 is the least. So, if you're just scraping like search interest for loss of smell in the States, 100 is going to be like maximum within the States, and 0 is just going to be, like the least within the States. I mean, one strategy that we've seen is to always scrape a reference country. So if you scrape like both the United States and Mexico, for example, like the 100 is going to be the largest value across the two states. So if you want to get kind of a globally comparative data set, you can always scrape, data both with like a reference country. So always scrape the United States, and you kind of create an indicator that's search interest relative to the United States. So that's at least one way to get, I guess, like a comparable time series as well. But I think there's a few different approaches in the literature, but that's at least one that I've seen it. I mean, for our work, we don't kind of like wrestle with that comparability issue. So everything's just kind of like relative within the country. But I think that could be a good approach there.
Yeah, it's really interesting, and I'd welcome any other panelists also to talk about that in their own work. I don't know if there's other thoughts on kind of these comparable, expanding the research to try and look at these geographic comparability estimates. So another question from Carolyn Tangoran. I think this is also for you, Robert. Have you looked at correlations in searches related to vaccine side effects and or misinformation with other historical measures of vaccine confidence across countries? So similar, but related to the specific kind of comparison. I'd be curious whether the two are related or if the search data could be suggestive of changing trends.
Yeah, I think that's a really good question and point as well, and so something we haven't done yet. I mean, with the vaccine misinformation stuff, that's stuff we've just kind of like recently scraped and have just started to look at. So I think that's a good point that we'll take. But I mean, I think the point is, you know, useful for kind of like the search terms more broadly, because right now we're just looking at the span of kind of like the COVID years, or you know, just starting January 2020. But I mean, something we should probably also do is kind of like scrape a bunch of these search terms in like the years past to kind of like check seasonality as well. Yeah, but I think that's, I mean, something we definitely want to do is kind of, you know, get some measures for vaccine confidence to see, you know, are the places that historically have, you know, not been confident, are they still seeing that similar misinformation, or are there kind of, is there a divergence between the two? I think that'd be super interesting to look at as well. Yeah. So something we haven't done yet, but good point, and we'll take your suggestion and look into that a little bit. Thank you.
Excellent. I had one question for you, Shankar. You mentioned that there was less or that co-location within cities was a kind of was found to be a bit of a larger driver of pandemic kind of the pandemic. I wondered if you had, if there are any examples of public policies tend to be more effective at reducing co-location across cities or municipalities. I wonder if there are any policies that were effective within cities or within localities that you were able, if there are any kind of examples that stood out where there were effective public policies that reduced co-location within smaller geographic areas.
Yeah, I'm not sure that I'm best positioned to speak to that. Yeah, I don't feel like I could give a good answer to that right now, just because I'm, yeah.
No, that's fine. I was just curious, yeah, if anything like that showed up, but maybe not.
Yeah.
Sam, you're muted.
Yeah.
Sorry about that. I think we have time for maybe one more question. Or so looking through here, there's a question for Ernest from Carolyn Tangoran as well. Ernest, you mentioned that colleagues at MOH used your findings to inform COVID-19 response. I don't know if you can elaborate more on this. I guess maybe what they used that data for, or yeah.
Yeah, so it was on the one sort of major things. So one of them was the thing I mentioned, for example, their messaging. They found, for example, that if they messaged more things using images or videos, then they got better reactions. So they changed the way they were communicating those things. What other things? The masks was something that was a big thing. It's unclear whether that influenced their decisions to release a policy, but that probably came a bit after that. So that was one other thing. The other smaller sort of local things that they clearly saw. So we had one graphic showing what people were commenting about some COVID, some other diseases and etc. And one of the things that was clear was that there was negligence of other diseases. So malaria is a big thing, etc. And so this was specific for KCCA. They also started sending more messages in that line. Then sometimes the trends, how many messages were sent on COVID cure or COVID soaps decreased. And so those ones were easy to see on a monthly basis that, okay, these numbers have dropped. Maybe more work is needed here from the public. So we're able to, there were small tweaks that they could do with their strategic communications that we managed to give them information to direct that.
Excellent, great. All right, well, I think that's all the time we have. And I really want to thank all of our panelists. These are just fascinating and fantastic presentations on ways that you're leveraging online data, social media data to really get policymakers the information they need to know about this pandemic and how to measure this epidemiology and to combat the COVID-19 outbreak. So really appreciate it. Thank you all.